let's not further delay, and let's welcome our guest speaker for today. I thank you so much, Dr. Veena Besnet, for being with us. So thank you so much for joining us. It's an honor to have you with us. Talking about Dr. Besnet, she is one of the few politicians, who believes mental illness is nothing to be ashamed of. And yes, it is not. It is actually nothing to be ashamed of. As I said, people should, come out of that boundary and speak out of their heart. And of course, neither it's it's nothing to be ashamed of, and neither it's talking about it also. And well, so Dr. Besnet, she has done MD in physiology, and she's a social activist and a politician. And she is a former SR from AIMS Patna and Lady Harding Medical College, Delhi. She had done her GR from Institute of Health and Elite Sciences, Delhi. She is currently associated with multiple NGOs in state and as well as nationally. And currently, she is the president of a regional political party, that is Sikkim, Hamro Sikkim Party. So, Dr. Besnet, thank you so much. As I said, it's an honor and a privilege to have you with us. So, the screen is all yours. Thank you so much.
Thank you so much, Dr. Satya, and thank you to Team Athena for having me on your program. In the middle of pandemic, we know that the pandemic is still going on and it has taken a toll on people's lives. But I think the only good part of this pandemic is that it has brought many things on the surface. And I believe health system, which I think in many developed countries, we always thought the health system is good, but it was a myth. So the myth has been broken. And in developing country like ours, it was already cracking, and COVID has just brought a catastrophe actually. So, the only good part of COVID is that now the health service, the health system, which was in shambles, is out on the surface now. And on top of that also, mental health. Because the burden of mental health was huge in India. It's huge globally, but India, it's so huge. But the problem here was addressing it or recognizing it. It was very difficult. But now, because of this pandemic, it is on surface, and now we know that the burden as well as how much it has increased during the time of pandemic. So, if I chose to speak on this event, global mental health, also because I think I fear this mental health illness more than the virus. Because virus, at least we know that it is a virus, we have recognized it and we are addressing it. And everybody is working to find a vaccine, or to find a treatment with a great vigor. But, a disease, mental illness, a disease with such a huge burden, the only problem we had was we were not trying to recognize, or the perceived need for care or addressing it was not there. And now, when it has come out on the surface, now addressing it, India now has to talk. Now India has to talk because it has taken a toll on people's life. When you see the global burden. In India, 15% is the burden of mental health disease, and every 7% you say is having either mild or severe mental health problem. But now with, I think, COVID, it has increased further. The research is yet to be done, right? The data has to be brought onto the table, and it has further increased. So that huge a burden, but not addressing it. It is a sad part in a country like ours that the pertinent issues, the main issues we don't address. So here, I think the main barrier to mental health illness is the stigma attached to it in India. The stigma and the discrimination and shaming. So, unless and until we come out as activists, or, everyone should come out to break this barrier, to fight stigma and discrimination attached to it. Because anybody having a mental illness, so let me just define mental health illness in a very simple term. It is the way how we feel, think, and as a result of this feeling and thinking, how we behave, right? In very simple terms. So, there is a lot of neurobiological changes happening, a lot of chemistry altered in your brain. But the first thing we don't do is the patient or the person who's suffering himself would be in a denial mode. Why? Because of stigma. They would not, because it is taken as a sign of weakness, worthlessness, hopelessness. The person who is sick or who is mentally suffering would also not want to say or come out that he is suffering. Like for other diseases, suppose I have some ailment, I would want to come out to in front of the family or everybody, society, or anyone to seek help. That okay, I'm having this, take me to the hospital, I'm suffering. But just imagine a person who's having a mental illness, who's having, I always say that there is a turmoil going in their head, but they would not want to first recognize or address it themselves. If they address it themselves also, they would not want to come out because of the stigma attached, because it is taken as a sign of weakness. They would not want to come out and seek help. Okay, some people, they come out. Okay, if they seek help also, they seek it secretly. And the family, when they come to know about it, because of the stigma, again, the family would be reluctant or would be hesitant to seek treatment. So, it's such a sad part that everybody who's fighting any other disease is always considered as brave, but somebody who's fighting such a huge changes in their brain chemistry or entire neurochemical changes. Just imagine a lot of things happening, but still they can't even go and seek help. So I think it's time for India. It's time for us to talk about mental health, because mental health is so complex, even with awareness. Just imagine what the burden is without the awareness in our country. So here, the paucity of knowledge, the barriers, I mean, the lack of awareness, it is literally taking a toll on people's life. And now, with this kind of scenario, like with this pandemic, we have seen that how difficult it was for people to deal. And now we hope to have more of these pandemics because of the bio warfare starting, because of this climatic change, the natural calamities happening. Now it will surface out more. So what options do we have? I'm very happy that Athena has started this online platform where at least people can come out. If there is a lot of stigma attached, also at least online platform which maintains the confidentiality of the patient or the person seeking help. I mean, it is such a boon. We are now, because it is digitalized and everything is digitalized. I think this kind of a platform where it really provides help for people who are suffering without being stigmatized, right? So I think this is a great initiative, and I think even the policymakers should realize that accessibility, first awareness and accessibility to mental health, to address mental health, and to early identification and prevention and therapy is really important. So for us now to come up with all this online platform, it is really important, and for people to know that there are platforms like this where they can talk out, they can meet to psychiatrists and psychologists and seek help. I think it is really important, and for now, I think it has to be spread out. The message has to be spread out, even in rural areas, because I think their accessibility to internet might be a little difficult. But still, like if the policymakers have that will, I think they can really mobilize this kind of a campaign, online platforms where people can seek help, and or just to even spread awareness. It is really important. So I think on this mental health day, we really need to take a pledge. We need to take a pledge that we will become the champions in spreading awareness so that there is early identification, prevention, and access to therapy. So it becomes a moral responsibility now to come out actively and talk about it. Because here we don't have a vaccine. The only vaccine or the hope we have is seeking help. Having awareness that there is an ailment going on, and we need to come out and seek help from the specialist. So I think taking this was the pledge taken on an individual level, but I think the policy makers now to mobilize that political will to address this mental health issues with great concern and to uh, divert more of funding research where we can have studies done on adolescents, adults, where there is more the cases of mental health illness to have some objective findings, because here mostly it is so complex that we don't have much of objective markers or things like that. So I think more of funding in research areas to spread awareness, to have easy, cost-effective accessibility to therapy. It's really important to have a more number of psychiatrists and psychologists, child therapists, and all. To combat or to address or to fight this epidemic of mental health illness is really important. So I feel that the only way to end this apathy towards mental health is to have empathy, to come forward, and I hope like everybody would be a champion in spreading the message of hope and to aware people. So I think I would want to end my talk on this note, and I would expect to have more conversation on the interactive session later, taking question and answers. Thank you.
Thank you so much, Dr. Besnett, for your kind words.